During the downtime, including the first day after surgery, I encourage everyone to not be bedridden, to get up, walk around the house, walk around the block a little bit, get that blood flowing so that you optimize your healing process. A lot of people ask me, what's the downtime after a particular surgery? So in terms of downtime, you can think of it as the time during which I can't run errands or I have to take off of work. For eyelid surgery, most people, if you wear glasses or frames, you can go back to work in a couple days. To that effect, the downtime after eyelid surgery, especially upper eyelid surgery, is really quick. One of the other aspects that people ask about a lot is when can I resume exercise? Because generally a lot of my patients are very healthy, they live active lifestyles, and so when it comes to eyelid surgery, I generally say about 2 weeks until you can resume complete full physical activity that you were doing before. During the downtime, including the first day after surgery, I encourage everyone to not be bedridden, to get up, walk around the house, walk around the block a little bit, get that blood flowing so that you optimize your healing process. So that's for eyelid surgery. When it comes to rhinoplasty, again, you definitely want to be ambulating, walking around the house, walking around the block. And most people are back to work around the time that the first post-operative visit happens. So about 6 to 7 days later after surgery, you get your dressings removed, you get everything checked out by me. Generally, by that time, people feel okay to go back to work. In terms of exercise after rhinoplasty, we generally recommend 3 to 4 weeks until you go back to your full-scale workout regimen. When it comes to facelift surgery, downtime isn't that much longer actually than rhinoplasty or eyelid surgery. In terms of feeling like you can resume work, especially if it's not a physically stressful job, you can probably go back to work in about 7 to 10 days, and you'll feel a little uncomfortable, maybe a little more winded throughout the course of your workday, but overall it's very manageable. And in terms of resuming your regular exercise regimen, again, probably about 3 to 4 weeks until you can go back to your full gym routine. But in the meanwhile, even on day one, I definitely encourage you to ambulate, walk around the house, walk around the block, get some sun so that you're moving and getting your blood flowing so that you can optimize the healing process. So yeah, in terms of facial plastic surgery, I think the procedure with the shortest downtime, where you can go back to society in a couple days, would be upper eyelid surgery. It's a very popular surgery because it's pretty instant in terms of giving your eyes that bright, more lifted look. And in terms of the facial cosmetic surgery that requires the most downtime, it would probably be the deep plane facelift and neck lift surgery. So there's a lot of moving of tissue to resuspend it to a more youthful position. So there's a little more time involved in terms of, I gotta stay at home, I'm kind of feeling winded, or everything throbs a little bit. Some of my facelift patients, even after day 4 or 5, they say, I feel up and ready to move about, run errands. These are patients who have an active lifestyle, who just mentally are go, go, go. And so for those people, around day 4 or 5, they say, I don't need any more pain medication. I'm doing well with taking care of the incisions and everything like that. So yeah, they're up and at 'em, which is good. The more you are active and getting back to kind of a normal day-to-day activity, it really does help with the surgery.